Okay, let's hold off any relays or check-ins, guys. This is AA4FL, the microphone for Whiskey Bravo 5 Delta. Today we're talking about hyperbaric oxygen chambers and therapy from them. So who's actually using them and why are they using them? This is Grand Rounds on the Air net here, simultaneous radio and Zoom interactive discussion. The reason for having it to be interactive is obviously we want our members to be involved. Not everybody has access to HF currently, and we want our members to have an input and output method. So I'm AA4FL at the mic, I'm secretary, but also doing this particular presentation today. So healthcare hams were also known as. The Medical Amateur Radio Council has a website, and so does Healthcare Hams. Today's presentation, or discussion, I should say, it's not a lecture, it's an interactive discussion that's net, is based on some slides that I produced that I posted to healthcarehams.org. So if you go to healthcarehams.org and you bring up that link to the slides, you'll be able to see the research notes that I'm using to guide the discussion today. We were formed in 1966 by a group of amateur radio operators. Of course, all of us are known as hams in healthcare fields. And the purpose is to promote goodwill and fellowship amongst radio operators worldwide who are professionals in the healing arts or have an interest in the various medical, dental, and allied fields which constitute the healing arts. And as part of our membership, we do have 3 in the immediate Los Angeles area. And of course, we all have many ham radio operator friends, and some of us have family there as well. And our thoughts and best wishes go out to all of them as they go through this stressful time that's not only threatening to their belongings, but all to their residences, but also to their persons, and turning their personal lives upside down. So as an amateur radio community, keep an eye out for any way that we can help those affected by the disaster in Los Angeles. Now, the Grand Rounds in the Air net is a ham radio net where members log in and have discussion. That's the basis for the net here today. But we do explore topics using the depth and talent within Marco to tackle the subject. With the net control operator, myself today, AA4FL, operating as WB5D, providing research for the discussion and doing it so based on the prepared PowerPoint with links, the one that we discussed. The discussion guide's available for all on healthcarehams.org. But we do focus on different target audiences, and our group of healthcare professionals who are members appreciate the science involved. So we do offer links to the research notes for more depth for those. And on the air, we're really targeting or talking as a group to all amateur radio operators, and you're all welcome to check in and participate. So we're using the radio waves here in 20 meters. So we're providing the net contents of interest, but we do have the Zoom video running that aids members who cannot afford the net, attend the net, not afford the net, no cost for the net, of course. But it does afford the general public with public service information because we convert the Zoom recordings from these radio Zoom simulcast sessions to be posted on our Healthcare Hams YouTube channel. And thank you for joining us today. It's a forum. Today is a forum regarding existing online public information, literature, and publications. Not the opinion of Marco and the Medical Amateur Radio Council or Healthcare Hams or any individuals, and certainly not medical advice. Our discussion is not an evaluation or testimonial about any products that we might discuss or companies that might discuss, either by your net control station or any of our members. We do and have compared online statements to scientific research, which of course is constantly updating and affecting considerations regarding the subject. Knowledge moves on from day to day. We hope the presentation here, or the discussion here, the interactive net will be helpful, as well as the presentation slides that are available for you on healthcarehams.org. We hope it piques your interest, and it's the basis for personal follow-up and further discussion between individuals, family members, and friends. And I know from me growing up in Miami, hyperbaric oxygen chambers were associated for years with decompression sickness. So, there's whole books and publications about diving physics. I do have a link on those research notes if you want to read all those details. It gets complicated because it's not only oxygen, so there's nitrox and other gases used, and people dive to different depths. We're not going to go into all the physics and science of it because that's a subject unto itself. But if you have that interest, please pursue that. So what is atmospheric pressure? I mean, the atmospheric pressure, the forces exerted on your body as you go into different levels, and the water, particularly through depth. The ocean is very deep, and the ocean could, if you shaved off all the continents and filled the trenches from the continents, the entire globe would be covered with water 2 miles deep. The average depth is almost 13,000 feet, 12,566. 3,800 meters. And, the greatest depth is over 11,000 meters, or 36,200. So we're talking Mount Everest proportions. So what effect does this great depth of water have on living things in the ocean? Well, we know from the depths into the Mariana Trenches that there are living organisms there, but it depends where in the ocean an organism lives. A fish or plant near the surface feels little effect from the great depths, but if it matters little if you're 6 feet or 6,000 feet beneath a swimming fish, the animal living at 10,000 feet, however, is greatly influenced by the depth of water. So we often speak of the pressure in atmospheres, and 1 atmosphere is equal to the weight of the Earth's atmosphere at sea level. It's about 14.6 pounds per square inch. So if you're at sea level, every square inch of your surface is subjected to that force. But for every 10 meters of water depth that you dive further down, you're talking about an increase of 1 atmosphere approximately. So at 5,000 meters, the pressure would be 500 atmospheres, or 500 times greater than at the pressure of sea level. So you can see why you would have to have very strong submarines and not have an implosion and such. If you're on Mercury, I have to look it up, but I think we're talking like, I think it's Mercury. I didn't know they had an atmosphere, but 99,000 times the pressure. So it would have to be a very thin atmosphere. We'll have to check and make sure we're not talking about Venus there. Might be Venus. That seems to make more sense. And you can look at some of the links here about atmospheric pressure that are on those research notes. And what about decompression sickness? What's actually happening? You have equal pressure when you get down to the level you're diving, and as you come up too quickly, when you get decompression, you start getting bubbles in your nitrogen in your bloodstream, and it has all kinds of metabolic effects as well as physiological effects. And I'm not going to talk about the pathophysiology. That's well researched. There's actually a link on the research notes for a course that covers all that. So if you're a health professional and you wanted to take a course on it, it goes into great depth for medical implications of decompression illness or decompression sickness. And also called diver's disease, the bends, as many of you know, caused by dissolved gases emerging from solution. Bubbles inside the body during that decompression are too rapid a rise from the depths of the water. Most commonly occurs soon after decompression ascent from underwater diving. There's other causes that can cause it, such as emerging from a caisson, decompression from saturation, flying in an unpressurized aircraft at high altitude, extravehicular activity from spacecraft. So that disease, compression syndrome, and arterial gas embolism are collectively known as decompression illness. And that the verbiage here is taken from a link on Wikipedia. I'm going to go ahead and pause one. First, we're going to take any additional check-ins. And if we have any relays right now and late check-ins, let's start with the relays. Make your call to Whiskey Bravo 5 Delta. KN0S, did you have a relay?
Yeah.
Okay, we have Jerry with us from Boca Raton, Florida, M4TSC. Any additional check-ins? Make your call to WB5D. No additional check-ins. No, I'm not a diver, so I really don't. I mean, I can talk about this vaguely. I'm not going into the science of it. Do we have any of our members here or any of the amateurs that are listening here on 20 meters that have done diving, that have something they would like to expand upon or offer some additional information, I'll make a list. Make your call to Whiskey Bravo 5 Delta.
Kilo Delta 4, India Zulu.
Okay, Jack, Kilo Delta 4 in the Zulu. Please go ahead and take the mic.
Okay, thank you, Jay. Oh, good. And yes, I am a diver. Advanced open water, so tremendously. However, the Divers Alert Network, and one of the best resources for information on decompression illness and the associated the problems that occur. Middle ear problems, all kinds of interesting other effects that are there. You should check in with them. I would add for those folks that are not diving or are considering diving, the Dan group, the Divers Alert Network, provides very rapid transport and care in hyperbaric facilities that they're associated with. And they do that all over the world. They have a wide network. So it's a very useful backup insurance policy, if you will, for active divers. Jay, that's all I've got on that. Hopefully, the rest of the information you gave sounded pretty good. KD4IZ.
Okay, thank you, Jack. I appreciate the contribution from a diver. And I guess those bubbles form or migrate to any part of the body, producing symptoms and its effects from joint pain and rashes to paralysis and death. So I would imagine that Dan organization also trains divers in what to look for, because you don't want the air bubbles to settle in major joints like your knees or elbows and being excruciating pain, that, getting the bends. And I'm glad they have an output or a way as an organization member to get attention to that susceptibility that one varies from day to day, but under some certain conditions, even though you're well trained, could still possibly have that experience. The classification types, according to symptoms, have evolved since the original description. It dates back to the 19th century, and the severity of symptoms varies from barely noticeable to rapidly fatal, according to the Wikipedia. So, Jack, KD4IZ, this is AA4FL to Mike in Hawthorne, Florida, net control here for Whiskey Bravo 5 Delta that Marco ran rounds of the internet. So, Jack, you've been around a lot of educational institutions, and certainly I have, at least in terms of one, UF. And I remember the 1980s, the early 80s, during my education, even the late 70s, having a large room with a gigantic hyperbaric oxygen chamber, and it was extremely expensive. We talked about it's the medical biophosphonate damage and wound care issues and getting circulation reestablished, and talking about that as in the dental context, Jack. It seemed like the costs were very expensive, and there was many different sessions. And I'm trying to remember what it was when I was in practice years ago, maybe $15,000 a session. Jack, what's your perception on the wound care aspects from a dental perspective? Go ahead, KD4IZ.
Actually, you can give more than that because, as you remember, I was with Organogenesis, a wound healing company, for a while. We worked on a dental product, but we also had products that were designed to help with diabetic foot ulcers, leg ulcers, and other poorly healing wounds. Basically, variations on the same technology, but most of our patients who are on the wound care side were on serial, and they could go on for many sessions. if you're trying to save a leg, I think it's a lot more important, than some of the others. As far as using hyperbaric oxygen to treat bisphosphonate side effects, that was sort of a Hail Mary. That's very difficult when those are out of control, and yes, it was used. I just didn't get involved with that to a great extent. But it's definitely a concern. And if you have somebody who's been on chronic bisphosphonates and has oral surgical problems, it can become very, very difficult with damage to a bit of the jaw structure. And hyperbaric oxygen does help in that some. But it's quite difficult. Jay, I don't know anything about the cost. I wasn't involved in that side, but I do agree with you that at that time it was extraordinarily expensive. I think now, with the proliferation of smaller chambers and the use in medical centers the way it has, the price is not the same. But it'd be interesting to hear from anybody that actually has experience with that and knows more about hyperbaric treatments and what charges are like. KD4IZ, back to you.
Thank you, KD4IZ, Whiskey Bravo 5 Delta. I appreciate that perspective, and let's talk about that here as a group if anybody does. But we also have Dave with us, KN0S, and Dave, how did you use this in wound care? And let me also point out that the jaw damage we're talking about, I would imagine it'd probably be different than, for example, a wound at the surface. But to get circulation to an area, I guess you have to have capillary support. I mean, you can always increase the blood flow to an area, but perhaps in the jaw, maybe that's the Hail Mary because you don't have the substructure for it to have an effect. So Dave, KN0S, if you're available to input before we move on to the issue of expense, can you talk a little bit about the times that you use the technique to assist patients over?
Yeah. I had 3 years of being on I used this for everything from dialysis related to I think about 4 or 7 other unique cases. When people had a lot of unit flights, they would be going up and down and up and down, rising the cabin. Most of the time we think of it for divers, but also pilots, the commuter planes on the lift. Or if they're black and they have sickle cell or sickle cell trait, I had one case like that. And they prescribe the aircraft tablets, 8,000 feet typically, even if they're flying at 15 or 20,000 feet. But the fact that they go up and down, maybe as much as 5 to 8 times in a given day, they can develop it. Divers related to it. I took patients that had arterial hemorrhage. You would find those patients at 3,000 feet. With patients for avoiding the pressure changes because that makes arterial hemorrhage worse. I used it for burn patients. And heal. It doesn't increase blood flow to the periphery, as you said, at the capillary flow is important. We use it a lot in gas gangrene. I had a couple of cases with osteomyelitis of the mandible related to dental infections, many of which are anaerobic, and it still improves healing for those patients. So that was a different piece. I've for deep dental infections. Facial trauma in the first Vietnam era with a lot of facial injuries. We also used it in the first Vietnam era when they were deep-seated infections from you were seasick on board, and then the people would jump out of the helicopter and tell themselves, giving themselves very deep anaerobic kind of infection in the groin and the lower abdomen. And those are very difficult to sleep because of the sleep contamination. Of course, we had a large operating room at Hennepin County Medical Center. If you go back in the literature, Richard Hitchcock, Bill Alden is a, and Wilson did a very good article on it. Where everything from dead bowel, nothing to the cavitis, conditions that typically involve a lot of anaerobic infections.
Okay, thank you, Dave Cam 0S. I appreciate that. I didn't realize your involvement was that extreme there. You're a fascinating resource, and thank you for making contributions. So we have other members that would either like to talk about the contributions to the ways that they used it in practice, or also about cost factors. And as we get into some of these off-label uses of new equipment, of course, we'll determine the miniaturization, not the miniaturization, but the ability to make these things smaller and more affordable, at least. And from a common sense standpoint, you would think so, but from a standpoint of monitoring on the medical side, that's still expensive. Do we have anybody else that would like to speak at this time, to ask questions as well? This is Whiskey Bravo 5 Delta looking. I'll make a list here for those that would like to further discuss. Okay, Dave, go ahead, KN0S.
We also have portable units that were years for diabetic, but also I think still being used today. We use those still like an outpatient therapy for diabetics, but also Virginia Commonwealth University at the VCU Medical Center. And so that worked really well. Anaerobic infections and often MRSA infections in the front office. The benefit from the small portable units, they put just the extremity in them, and then the type of food especially. So if you want to do that, that's pressure with 100% oxygen, that's the thing that help what we're doing. Those are still being used today.
Okay, thank you, KN0S, Whiskey Bravo 5 Delta. Again, this is AA4FL operating at the mic net control from Hawthorne, Florida. And if you would like to see the research notes that we are using to prompt our discussion today, go to healthcarehams.org, healthcarehams.org. So while you're on 20 meters, you can simultaneously look at the slides that we've created with research notes active that I think you'll find very helpful and bring a lot of meaning in addition that you can't exchange on the air. So healthcarehams.org. Plus, I think you'll find the website fascinating. But if we look at oxygen therapy, I mean, obviously there are traditional uses, wound therapy that we just talked about, treating the bends. And I know we have a few ophthalmologists with us today that would like to make comments. But until we get to that point, let's just take a look at what the FDA actually has for consumers. If you go online and start searching the facts about hyperbaric oxygen, in those presentation notes that I have available for a link there on our website, you'll find a link to consumer updates on hyperbaric oxygen therapy. Get the facts from FDA.gov. So if you don't want to look at the link, you can at least Google that, the FDA consumer updates on hyperbaric oxygen, and you'll be able to read some of the what we're talking about here. So the conditions which are cleared for the FDA, this is in 2001 as of then. It includes, it obviously considers this a medical device. It includes a determination that the device has the same intended use and is safe and effective as other legally U.S. marketed devices of that type. And it cleared the chambers for the following disorders: air and gas bubbles in blood vessels, anemia, severe anemia where blood transfusions cannot be used, burns, as Dave had brought up, or severe and large burns treated at specialized burn centers, carbon monoxide poisoning, crush injuries, decompression sickness, which we've already talked about, the bends from diving risk, gas gangrene, which I believe Dave had mentioned. One that hadn't heard mentioned, hearing loss, complete hearing loss that occurs suddenly and without any known cause. That's listed as approved for treating that. Infection of the skin and bone, radiation injury, skin graft flap at risk of tissue death. Now for our ophthalmologist, vision loss, when sudden and painless in one eye due to blockage of blood flow changes occur. Wounds, non-healing diabetic foot ulcers, which we just heard from Dave. So if you go to that list, FDA.gov, hyperbaric oxygen therapy, get the facts, Google that, you'll see that. Now, if you look online, though, we talk about the internet extensively and be able to research on the internet as a consumer, as somebody that's either in a health field or not in a health field. We all go on the internet looking for information. You'll find many different websites. Some are manufacturers, some are organizations, some are companies, therapists. The one that I found, which was HBOT Chicago, if you look that one up, they have approved applications versus the off-label uses. And they chime in with the FDA conditions that we just talked about. And hyperbaric oxygen therapies being established medical treatment involves breathing 100% oxygen in a pressurized chamber. Therapy has garnered attention for its diverse applications, ranging from treating decompression sickness to exploring potential benefits for neurological conditions. So perhaps Munir will be able to talk about that later as we bring up some of the neurological conditions. And it delves into the intricacies of it, contrasting the FDA-approved uses with a variety off-label, as well as examining the scientific evidence and controversy. So you can bring up that website and look at it. But despite the established FDA-approved applications, some of the off-label conditions they say are used often driven by preliminary studies, anecdotal evidence, and patient demand. So common off-label applications include traumatic brain injury, explored as a treatment for such. Some studies suggest it can reduce inflammation, improve cognitive function, and enhance recovery. However, the evidence is mixed and more robust clinical trials are needed to confirm its efficacy. Stroke recovery, again in the neurological realm, stroke patients may benefit from HBOT as it can enhance neuroplasticity and support brain recovery. In some preliminary studies and case reports have shown promising results, but larger randomized trials are needed to establish its effectiveness. What about autism? Autism spectrum disorder. It's used by some practitioners to treat autism spectrum disorder based upon the hypothesis that it can reduce neuroinflammation and oxidative stress. And some small studies have reported improvements in behavior and cognitive function. The overall scientific evidence remains inconclusive and controversial. Lyme disease, thought to be a help by increasing oxygen levels that can kill the Borrelia bacteria and reduce inflammation. Anecdotal evidence supports its use, but there's a lack of robust clinical trials to validate these claims. Fibromyalgia, characterized by chronic pain and fatigue, may seek this as a potential treatment. There are some studies that suggest it can reduce pain and improve quality of life, but research is needed to confirm that. Cerebral palsy, as well as also some initial studies have shown the benefits. The results are inconsistent and more comprehensive research is needed to determine. So if you'd like to bring up that particular, the research notes that I've used to base the discussion off of on healthcarehams.org, you'll have active links to all these sites. Might be easier than searching the internet. Mechanisms of action. What are the main mechanisms? How does it work? Hyperoxygenation, the amount of dissolved oxygen in the blood, it increases it, enhancing the delivery to the tissues, particularly in hypoxic or ischemic areas. And this increased oxygenation supports tissue repair, reduces edema, and helps maintain organ function. I'm going to pause a second for ID. Medical Amateur Radio Council rounds of the year. We're talking about hyperbaric oxygen therapy and treatment. And do we have any other stations? And we'd love to have you involved in the conversation. Do we have any late check-ins? Go ahead and make your call at this time to Whiskey Bravo 5 Delta. Okay, is it KC1JLL in Cape Cod? Is that correct?
The name is Johnny here on Cape Cod. I'm a commercial diver. I just wanted to check in and out real quick because I have to go out the door. But I have a question for you. I've been listening to you guys for a while.
Okay, Johnny, we'll have your question. Again, let me just confirm that I have the full call. I've got the Kilo Charlie 1, and I know it's ending in Lima. What's the rest of the call?
Yeah, Kilo Charlie 1, Julia Romeo Lima, 1JRL.
Okay, thank you. Thank you, Johnny. Juliet Radio Lima, QSL. Okay, Johnny, we have all the 20 meters listening to your question. We also have a simulcast on Zoom, so people all over the world, it will be also made into a YouTube video. So please do go ahead and ask your question.
Okay, well, being a commercial diver and still studying all that math and stuff, I went to Minnesota for my commercial diver training. Did some trips in the hyperbaric chamber. I was the guinea pig. I was trying to learn how to operate the hyperbaric chamber. And yeah, it's pretty wild when you sit there and you can actually feel the air in front of you. And you get water and it falls slowly. But you were mentioning something about hyperbaric medicine for hearing loss. Like for a gradual hearing loss in the elderly. Is that a possibility of any kind of treatment for that type of hearing loss?
Well, we haven't gotten into the hearing loss for the elderly. I know there's some applications. I think it was more of a sudden loss of hearing, not a gradual loss of hearing. And we've had sessions on hearing loss and the cilia, the different receptors over time, they get destroyed. So I don't think that's a matter of circulation. But again, I don't know the definitive answer to that. It sounds like a fascinating discussion unto itself. That perhaps we can entertain in the future. It's an excellent question, Johnny. There are a lot of other off-label uses we're going to be having a net discussion about and asking individuals to contribute their knowledge. Do you find that helpful, Johnny? KC1 JRL, Whiskey Bravo 5 Delta.
Yes, Whiskey Bravo 5 Delta, Kilo Charlie 1, Juliet Romeo Lima, North Shore, Cape Cod. Yes, thank you. I'm going to look into that because I was when you mentioned, especially dental. Oh boy, I get some. I checked out. Yeah, one of the things I did experience while diving, I heard the other station and they're talking about Dan. I always go to the Boston Sea Rovers convention every year. It's usually in early Jackson Show, Dr. Ballard, met all them there at one time. They're all members of the Boston Sea Rovers. They have a great website. And part of the South Shore Neptunes, I'm with a scuba club also. That's the fun part of diving for me. But the Boston Sea Rovers, South Shore Neptunes, all in the Massachusetts area, they have a great organization. And one of the things I did experience while diving just before I check out was hypercapnia. Really taught me a lesson. Not gassing off enough of the CO2 while you're down at depth. And then when you come up, it feels like you're not breathing at all and that you're going to suffocate. And that taught me a good lesson that anytime you start to feel that while you're diving, you actually just drop down a little bit until you feel more at ease and less agitated and gas off that CO2. Anyway, that was my one diving experience. But just if you could give me on your final a little bit more about the net here and the name of the net, because I never get on 20 meters much, but I did tune down 40 meter dive ball and was listening to your conversation. So With that, I say 17, just on your final, if you could give me a little information about the net here. Thank you.
Oh, sure, Johnny. KC1JRL, Whiskey Bravo 5 Delta, the Medical Amateur Radio Council. This is our grand rounds on the air net, historically on Sunday mornings at 11 Eastern, because the doctors years ago when they formed the net, it was one of the few times they weren't having to make hospital rounds. And that tradition has prolonged to this day. We've been doing the net for many years. The organization, the Medical Amateur Radio Council, is ARL affiliated. It's existed since 1966. We have two websites. Healthcarehams.org is probably the easiest one for you to remember. Just Google Healthcare Hams or look up healthcarehams.org. You can also look up Marco, like Marco Polo, Marco Medical, and you'll find our website there as well. Johnny, one thing that you might find interesting is our YouTube channel for Healthcare Hams. You'll find these presentations are made into YouTube videos for the general public. And you might want to look back at 1776. We did one on medicine in 1776 that I know is up there on the YouTube channel. And it talked about the Boston area in the early days of medicine, and how important it was for doctors in the community, and talks about it in terms of the Revolutionary War, because it was a maritime economy. It was one of the more wealthy areas where you actually had professionals here in the country in the early days. So I'll say 7-3 and let you run, and hope you'll watch the YouTube video that we produced that probably be on later today, Johnny. 7-3, KC1 JRL, Whiskey Bravo 5 Delta, AA4FL to Mike. Do we have any additional questions or input before I continue on with the mechanisms of action? Make your call now. Okay, Whiskey Bravo 2, is it India Delta Victor, is that correct?
That is correct.
Okay, go ahead and proceed. Take the mic.
No, so the discussion type of hyperbaric oxygen it's very useful modality. It's also, you mentioned with stroke. In my experience, I've used it with stroke. And it's more important that they get into the hyperbaric chamber as soon as possible, because it's only lacking oxygen. And those areas, the penumbra, the immediate areas, need that oxygen immediately. Going to the hospital usually delays it with a CAT scan, with an IV, with evaluation, for getting to the floor. And generally in the hospital, this is not a true procedure by Medicare or by the insurance company. So you're being denied this. My advice to my patients, if you ever had a stroke, you need immediate hyperbaric oxygen. And it brings back function immediately, because that's what you need. I did take a course down in Texas at San Antonio, and that's what they had. One of the instructors had 5 strokes, and he recovered from each one of those. And it was very interesting. They also had a dental portion where it restored the jawbone and allowed the implants to go in. So I don't want to take too much time, but there is a lot of use of this. And I also recommend to anybody who's still practicing to go get a 4 or 5 dives, as we call them, to know what you're walking paper and what it feels like. You have a first-hand experience. It won't hurt you. It'll benefit you. Whiskey Bravo 2 India Delta Victor.
Okay, thank you very much. And what's the handle? What's your name?
My name is Rich.
Rich, thank you very much for coming on board and making that contribution. We're happy to be here on 20 meters and get input from individuals that are members and non-members and the general public as well, but had another health professional on board that had a different perspective or additional perspective, which was quite helpful. Thank you for being here with us today. And is it okay? You're going to be included, and we're going to be making a YouTube video. Is that okay, QSL?
Yes, it is.
Okay, thank you very much, Rich. Any other comments before we move on to these mechanisms of action, which also may help chime in with Rich's comments? In addition, we're going to have off-label uses, and we'll talk about some of the insurance issues in terms of cost as well, just in engaging in some of the equipment and its potential end users. Make your call to Whiskey Bravo 5 Delta if you have a contribution you'd like to.
Comment.
5 RTF, go ahead and take the mic.
Yeah, I'm on Zoom, and this is N5RTF. One thing that needs to be considered from a psychiatric standpoint, about 12% of the population has claustrophobia at a clinical level. In the older style chambers, they were large enough for people to stand up, walk around, and have 3 to 6 people in the chamber at a given time if they had a group of divers. As we move to smaller and smaller chambers, they are cheaper, but there's a certain number of people that are going to panic, feel like they're being buried alive. And if a good question, history question is, have you ever had an MRI? Did you have any problems getting in the tube? Did you get anxious? You don't want to put somebody in a small hyperbaric chamber if they're going to have a panic attack, because you can't just pop the top and let them out. It may take 30 minutes to an hour just to depressurize safely. So you could have a bad result if you don't consider that as well. N5RTF.
Well, thank you, Chip. N5RTF, Whiskey Bravo 5 Delta. That's an important perspective. Let's talk about some of the other mechanisms of action, and then we'll get more contributions, especially on the neurological side and the ophthalmological side. So we're dealing with that hyperoxygenation, but angiogenesis and neovascularization is what we're looking for, is new blood vessels and the repair of damaged ones, which are critical for wound recovery and recovery from an ischemic or radiation injury. And we're talking about an ischemia here. So anti-inflammatory effects, perhaps some of these off-label uses are intended for that particular reason that we'll talk about. We've talked about the ones that are approved, but we haven't talked about the off-label targets where it claims that would be part of the reason for their application, even though it hasn't been scientifically proven yet. Antimicrobial effects, Dave talked about that, KM0S talked about that, but it could also, the growth of anaerobic bacteria, but enhances the efficacy of certain antibiotics. So that could be useful in certain infections. And he mentioned chronic osteomyelitis. So Dave was giving us information that was also found in the research. So the safety and risk, they're not without risks. Common side effects, barotrauma to the ears and sinuses, and myopia, temporary myopia, and oxygen toxicity, but they're rare. They can include seizures and pulmonary barotrauma. So it's crucial for healthcare providers to screen patients. And Chip at N5RTF just mentioned that from a standpoint of psychiatric input for the people that might be susceptible to psychiatric or just any kind of health effect, mental health effect, not necessarily a severe one, but there's people that have claustrophobia. So the regulatory and ethical considerations from non-FDA approved indications, that obviously raises questions. On one side, there's advocacy for patient access to potentially beneficial treatments, but on the other hand, there's concerns about efficacy, safety, and potential exploitation due to a lack of robust evidence for many off-label uses. So we've got this constant interplay of regulation, and it'd be interesting to see what direction that takes in upcoming years if we're going to have this particular area regulated as much as it is now, or how fast they're going to respond to some of these other requests for uses. What about COVID-19? It has not been cleared for authorized use of devices to treat COVID-19 or any conditions. There's lots of people that have long COVID. And you can look at clinicaltrials.gov to see if there's any more information. That's an FDA on the consumer site. You can find articles. There's scientific articles online. There's one that I found, Effects of Hyperbaric Oxygen Therapy on Long COVID, a systematic review. And as you go to these different articles, you'll get some perspectives. But according to this one particular article, current evidence is mostly established from case reports, or one group pre-test, post-test design studies. So even from these research clinical trials, there were 3 that they found that the article is based on the same patient population that they were looking at. And moreover, the precise timing of the intervention, therapy protocol, and patient heterogeneity may influence the outcome. So further rigorous large-scale studies are required to establish the indications, protocols, and post-treatment evaluation. If you would download or look online at healthcarehams.org, our research notes are there, and they'll have links to that article. We're gonna pivot here now, and before we talk about some of these uses, let's just look at hyperbaric oxygen chambers. You know, how, who, and what are they advertised to online today? If you go online, you're going to find all kinds of links to manufacturers, suggested questions to ask before buying a hyperbaric oxygen chamber. And from some of the sites, I'm going to quote some of what I've read. One company's mission is to provide the highest quality hyperbaric chambers available. They're tested for 5 years at 3 times the normal pressure. For durability, people use hyperbaric oxygen chambers to treat medical conditions, enhance athletic recovery and performance, support overall health. And the type of chamber you invest in, so I don't know who the target is, you, affects the benefits the user can enjoy during a therapy session. Getting the right equipment for personal use or clinical services by asking these questions before buying a hyperbaric chamber. So you'll actually find personal use as a target audience by many of these companies and manufacturers. There are frequently asked questions that you can find that talk about hyperbaric oxygen chambers, and if you go once again to our research notes, you'll find some why their chambers are on the market, and again, who they're marketing to. One particular company said their desire is to get as many chambers in the hands of people who need them, and their main channel of business is on the internet. They do not have the overhead of larger companies. They don't have expensive marketing costs. They partner with resellers who share in their same values and goals. More expensive doesn't always mean better. But I mean, these are medical devices, and the FDA is looking at them as medical devices. Having equipment is one thing. Being trained to use them, who's monitoring them, is another. And one of the manufacturers had 3 different subsets of menus to look at. They looked at the industries, they looked at the treatments, and they look at the chambers by pressures that they produce. They produce chambers from 1.3 to 3.0 atmospheric pressure. And the treatments that they listed, we'll go over some of the off-label uses here. But interestingly, industries that they target to, there's therapy centers, chiropractic centers, wellness and spas, fitness centers, sports centers, beauty salons. I mean, I don't know too many beauty salons that have medical staff that can supervise the hyperbaric oxygen chamber. But even more surprisingly, personal home use is one of the target audiences. So yeah, we got some serious stuff going on here on the internet, guys. So I think it's important to get these notes and look them over. And if you just do a Bing search return, you'll get the best hyperbaric chambers for home. Which hyperbaric chamber is the best for your home? And you'll get different links. You'll find many different sources and opinions and the reason why they suggest that. So if you go ahead and do a search for best hyperbaric chamber for home, please do and see what you find. There are soft oxygen chambers that sell for as little as $12,900. So that, looking at those, I wasn't aware of that, but there's also a vertical one that was $14,900, standing up for therapy. If you look at the research slides, the thing that came to mind on the vertical one, and I know Barry, WB1FFI, and I were talking earlier, on the horizontal one, it came to mind the comparisons with the nitrogen pods we talked about last week for end-of-life issues. But what came to me on the vertical one, Barry, in the group, and this may be a little risque, but it was the movie Sleeper, the 1973 movie Sleeper, where he had a device for another purpose that was risque. And if you go to the research notes, it was a vertical chamber that you would get in. You would intentionally get in there. And Woody Allen, unfortunately, was hiding from people pursuing him. He was in there alone and tore himself up. So that being said, I'll let you guys open up the link. There's a 5-minute video that goes through the appropriate ones if you go to the research notes. And that's something that I grew up in my teenage years. So. But there's also hard shell chambers for $61,000 that are for sale. So we're not getting into the expense on the equipment side. I mean, that certainly is making a big improvement over years ago, what we'd seen in these big health centers. But, what about all the monitoring? I mean, who's monitoring these treatments? So before we move on, let's see who would like to make a contribution. Let's talk about some of the uses for ophthalmology, what we may have been exposed to. Barry, WB1FFI, would you like to take the microphone? Go ahead.
Yeah, this is Barry, WB1FFI. Ophthalmology. Like the topic was retinal artery occlusion, retinal artery occlusion. The point being made is included as stroke of the eye. Using the term that most people are using with muscular blockages. And they are emergencies. They need to be dealt with within 6 to 24 hours. Ideally, the magic time for stroke is before 4.5 hours. So you see the limitations that we run into to appropriate diagnosis, depending on where the patients are located, whether they're getting to a repair or a facility setting, whether there's distribution of the condition. The hormones will be decreased vision, particularly in one eye. It's acute. History of stroke or a heart issue. The diagnosis is the primary problem. This is something properly diagnosed. Referred to a stroke, which means not to emergency room, an emergency room providing thrombolytic therapy, IV, to clear the blockage. With the oxygen, like they provided the approved uses monocular blindness from is on the list. So it's not possible to use. It is a quote usable use. And the problem again is getting the proper evaluation. It's sort of a number of reasons, but also as alluded to earlier, all of the issues involving it. Again, for one of these things, we're hopefully stimulating new blood vessel growth. The main graphics has been released. So it's not like any more treatment. It's usually and what our neurology colleagues have to say about this. We're talking stroke, in the brain, or about stroke in the central retinal artery or trans artery. So I'm going to send this back for further discussion. 4FL, WB1FFI.
Yes, thank you, Barry. WB1FFI. This is AA4FL, the mic operating from Hawthorne, Florida. This is the Grand Rounds on the Air Net. We meet every Sunday at this time, starting at the top of the hour, at 11 o'clock Eastern, running a little longer today than our usual hour. It's a very intricate subject. And I hope you're finding it fascinating that we're all discussing this as a 20-meter net. Everybody's having the opportunity to ask questions and such. Our club calls Whiskey Bravo 5 Delta for ID here. We do have a neurologist with us, Munir N3PQ is with us. Munir, we've got on-label uses, FDA approved uses, and then we've also been talking about some off-label potential uses. I mean, we'll get into claims here shortly, but people are claiming that it's helpful for autism, for Alzheimer's, and I mean, it goes to all other things beyond. They claim inflammation is the boogeyman. Of course, anything with ischemia is, more targeted and understood. Any comments you'd like to make at this time, Lanier, N3PQ, Whiskey Bravo 5 Delta?
Yeah, thank you, Jay. This is N3PQ. This is Munir. Yeah, I'm not personally at all familiar with hyperbaric oxygen treatment. I have looked up some articles. The evidence for some of these claims is very tenuous, to say the least. I mean, some of them seem to be well established, but I'm reading here a list of where it might work and how it might work. Mitochondrial function, neurogenesis, angiogenesis, synaptic and axonal formation, telomere elongation, which I think it means we'll live longer if we have longer telomeres, anti-inflammation, brain-derived neurotrophic factor. And this article is in a legitimate journal. No, they're not making the claims, they're just reviewing. And actually some of the contributors are neurosurgeons from the University of Pittsburgh, near where I am. So there are legitimate reviews. I think it's very important to sort through all the claims. And I don't know of anybody doing any serious research that I have read with Alzheimer's. I know some are doing research with stroke, post-traumatic or traumatic brain injury. But some of them I think are too good to be true, to be honest with you. This is N3PQ.
Thank you, N3PQ. This is Whiskey Bravo 5 Delta. Yeah, there's a lot of claims being made out there, obviously. It brings two things to mind, Barry. We were talking about the size of some of these chambers, numerous of you, CHEP N5RTF was also talking about it. And we were discussing some of the claims the companies make and the reason why they feel they're producing these. And it was to get it in the hands of as many people as possible. They just didn't specify what people. So the cost of the equipment seems to be going down. But we're talking some pretty intense uses. And to get therapeutic benefits, assuming it's FDA approved, who's monitoring the progression? Look at some of the approved uses and the ones that are off-label and who the target market is targeted to. Now you get a piece of equipment that costs $13,000. Is it going to end up in somebody's home with their husband or wife monitoring because they think it might help Alzheimer's? Do we have any questions of Munir, of N3PQ? I'll make a list here of anybody who'd like to ask a question, a neurologist. Go ahead and make your call to Whiskey Bravo 5 Delta and we'll get a list going. Yeah, Munir, we're not going to put you on the spot here today, so that's good.
Thank you, because I don't know much about it.
It's interesting, Munir and we sit here and kind of chuckle about these issues. You start talking about one thing and you get into the depth of it and you realize that every subject we talk about or topic or aspect or perspective we talk about in itself is something that needs to be talked about. So this is fodder for future Grand Rounds of the Internet. If you're a general amateur in the general amateur community, or you're in the public, because we're going to make a YouTube video and seeing this on our YouTube channel, and you have particular questions or suggestions you'd like us to cover on these nets, we're on the airways. It's a public 20-meter airways for amateur radio operators. This is for all amateurs. Now go ahead and write us. we'll go ahead and talk about it. So there's another company that we looked at. There was a question that Barry asked me to look at, WB1FFI. How long does the session last? You know, it depends who you ask, Barry. I mean, we don't know what the problems are they're trying to treat. We don't know how many. Look at the manufacturers having 1.3 atmosphere. The chiropractor I used, he was in that range, like 1.4, 1.5 ATM, and he was using it because he lost his vision from long COVID. And that's how he got started with those treatments, and now he's using them in his practice. But if you look at the discussions of duration, one company says that can vary based upon the specific protocol requirements and based on a specific recommendation from your healthcare provider. However, a standard session usually is between 60 and 90 minutes. But you'll have other sources that say some conditions may benefit from being treated twice a day for at least a short period of time. Some other conditions, which can be healed or cured by traditional or hyperbaric methods, may require a longer period of treatments. And they say in this particular source, 60 to 120 minutes for individuals. The duration of your treatment is considered alongside the necessary frequency of the treatments when developing your personalized plan. I mean, how many dives do you have to take to get the improvement that you're looking at? And that begs the question again, if these are ending up in home use or spas or beauty salons, who's monitoring? How are they using them? How does it stack up with FDA approved usages? And if not, what are the societal pressures towards moving towards those things being approved? I mean, we already know, if you look at some of the uses, that wound care is approved use, and the reason why helps to heal slow to heal wounds, such as diabetic ulcers, radiation injuries, and severe burns in multiple sessions can accelerate the healing and restore tissue integrity. So this is from one of the manufacturers. And if you look at the research notes, healthcarehams.org, you get the slides with the active links, and you can read into more detail that we can talk about on the air. But sports medicine, it's integrated into sports medicine. Many professional sports teams and training facilities use this to help athletes recover quickly and return to peak performance. So I would assume they have a medical staff, but you'd have to ask each individual team. What about autism? Because that's a claim, because it's a complex neurological condition that can present a wide range of challenges for those affected. And during a session, patient sits or reclines in the specialized chamber that's filled with 100% oxygen and higher than normal atmospheric pressure. This increased oxygen concentration allows more oxygen to dissolve into the bloodstream and reach the brain and other tissues that may be underperforming in individuals such as those with autism. Is that a true statement? Is exaggeration scientific based? That's for you to decide. Again, each question here is an entire presentation or discussion unto itself. One caught my eye was healthy aging. Potential benefits. The proponents argue it can prevent cognitive decline, strengthen the immune system, slow neurodegenerative conditions like Alzheimer's. So what's the conclusion? There's a growing body of evidence, they claim, that suggests the sessions may be a valuable tool in the quest to extend health and longevity, giving individuals to not just live longer, but to live better as they age. Does that mean that some of this marketing that's available to the public, are individuals going to be able to buy one and put it at home and take a dive in it every day? Or who's going to set the protocols and the requirements and determine whether or not it's effective? I mean, that an off-label use. It's certainly something that seems to be marketed. That particular company also hints at home use. What about dementia, ADHD? The studies, according to the company, indicate that HBOT may enhance neuroplasticity, reduce inflammation, and promote brain cell regeneration in patients with Alzheimer's, vascular dementia, and other forms of cognitive decline. Now, the pressurized environment also improves oxygen saturation, utilization of the mitochondrial function within brain cells, bolstering the resilience against degenerative processes. That's the claim I think Munir went over that a little bit, but HD also is another one that's claimed for similar reasons that can improve focus. So these again are off-label uses, statements being made by manufacturers. We are not here to evaluate the statements. We are not condoning, we're not supporting any technology. All we're doing here is serving as a forum for discussion. We're making these research notes available to all amateurs, to the general public. You're more than welcome to pursue more information. And certainly if you feel that any one particular area is of immediate need of discussion, we would consider making it a Grand Rounds on the Air subject material. What about wellness? Because it lowers stress levels, induces deep relaxation and tranquility. I mean, what if you're having problems sleeping? Is this going to be used for that as well? There's, the hint of this in the marketing. So skin health, we talked about beauty parlors. I mean, we know it treats diabetic foot ulcers, radiation damaged skins, and stubborn acne. Stubborn acne, I mean, I guess, I don't know. I'm not a researcher. I don't know if that statement's accurate at all. Can it reduce fine lines and wrinkles for radiant complexion? What are we going to have every beauty parlor have these? Isn't that interesting? You can have a tanning booth in one room and a hyperbaric oxygen chamber in the next, and you can go back and forth, cause the damage, and treat it in the same place. Interesting conversation.
Comment.
Go ahead, Chip N5 RTF. I'm going to turn the mic over to you. This is Whiskey Bravo 5 Delta.
Yeah, this might be something for another presentation, but go to the flip side. If high pressure oxygen is good for you, what about low pressure oxygen in compromised groups? Commercial airliners are pressurized to 1/2 of normal atmospheric pressure. People go on long flights. Somebody with early stages of dementia or a wound that's currently in stages of healing, including dental work, should they fly? In fact, you might even say, should elderly people ever fly? Or should they vacation in Colorado if they've lived all their life at sea level? Some interesting questions there as well. So I'll throw that back to you.
Oh, thank you for that perspective, physiological perspective. Very, very interesting, Chip. Thank you for participating. Some of the companies will also tell you how to prepare for a session. And again, the target audience here, this one particular page I found on the website, preparing for a session requires a bit of planning and preparation to ensure the experience is comfortable and effective. If you're getting ready for your first session with a chamber in your home, read on to learn what to do first. It sounds pretty explicit to me. Even the symptoms to watch for, like dehydration, discomfort, and ear pain. So is somebody monitoring to them? Or are you supposed to be looking for these symptoms yourself? It gets to a pretty gray area there, but I'll let you determine and read for yourself. But which type of chamber will suit your needs? This is another company. A market offers a range of hyperbaric chambers, including monoplace and multi-place models. Monoplace chambers are designed for use by one person at a time, making them perfect for personal use or small clinics. Whereas multi-place chambers can accommodate several individuals simultaneously, which is ideal for larger facilities. And Chip and RTF had mentioned this earlier. And of course, ask about safety features as well. But home use, really? Are we considering these? What does home use mean? Do you have a medical professional that you hire? Is this intended for ultra wealthy people, or are frustrated patients that are having all kinds of symptoms that are moderate in their economic ability to afford care, going to try to circumvent expensive provincial care, put them in the home? I don't know what they require for you to buy one, but there's an entire area on hyperbaric chamber safety features on a few of the slides that we have in the background material. It goes through probably about 20 different aspects of it, including the safe depressurization, which I think Chip had mentioned before. It takes time to depressurize safely in case you have a trauma when you're inside that chamber. So how will society and law look at advertised uses of off-label use of hyperbaric oxygen chamber in the future? And, we did this overview today, and many follow-up questions came from it. And send in your desire to further explore an aspect of the content provided, or just to present your findings for discussion. One of our grand rounds on the internet. If you go to the research notes, I've given my contact email for individuals that would like to email me and follow up, whether you're a member of the general public, a member of the amateur radio community. Now, there's many others here that are with us today that have not commented yet. Would anybody else like to comment, either in asking questions or present some follow-up information, or do we have any more ophthalmological input or neurological input from others? Go ahead, I'll make a list. Make your call to WB5D. Okay, KM0S. Anybody else before we ask Dave? Okay, KN0S. Go ahead, Dave.
It's interesting. Every time I go over to Silver, we tried to take the pressure down gradually, and also coming up gradually. I was doing a diving in the gas, and that's the time I got on the transfer. That's the time that I had to do a 200-foot dive. We had a diver that had sort of achieved the bend, and as I went down, especially in my ears, I had no hours before that. Before getting on a plane and flying to Minneapolis. I had a pressure in my ears to the point that one of the eardrums punctured. We were upstairs through diving in the chamber to open up the hole like a PE tube in the eardrum to relieve the pressure. I had pressure, if it had dental problems, it had a previous crown. Sometimes there'd be a tiny air bubble, and under pressure that would change, and it would give them pain during the day. They would come in with dental pain. But the sinus pressure and also the air pressure would be tremendous. That's why I worry about home use. Especially those things that you have to control personally, because you have to do it really slowly. And I noticed on those ads that you published that they have a way of adjusting quickly where you don't really want to do that. It can be very suddenly therapy messages like going up in the mountains or having pain when you're in an airplane or stuff like that. But it's much more quick if you were suddenly to use some tests from hyperbaric oxygen over.
Oh, yeah, thank you for those comments. And those of us that fly certainly can relate to that. And thank you for pointing that out, Dave. Do we have any additional comments or input? Realize that this is Grand Rounds in the Air 20-meter net. There may be individuals that can't hear me that are involved. Some individuals will be looking at the YouTube video we produce on our Healthcare Hams channel. And that's the reason, one of the reasons why we do that, not only for our own members, but for the general public that aren't listening to 20 meters. Do we have any additional comments before we bring the net to a close for today? I'll make a list. Go ahead. Well, thank you very much for everybody being here. We're going to be looking at traumatic sports industry injuries next time. We'll have the Condors with us, Alana Condor, specifically on children. Injuries with children. We'll have a forum, an interactive forum where everybody will be able to ask her questions, since that's her expertise in the field, as well as her husband, Bob Condor, has quite a bit of experience as well. So this is AA4FL at the mic. This was WB5D, the Medical Amateur Radio Council, and our Grand Rounds in the Air net. Feel free to look me up on QRZ, look our organization up. WB5D and ARL affiliated club on QRZ. You're welcome to email us with any follow-up questions. Check out our website, healthcarehams.org, and certainly the YouTube channel. Thank you for everybody joining us here today. We're going to bring this session